So how do you broach the topic of weight loss with patients, and what have been some of the common challenges you've come across?
So for me, because I'm an obesity medicine specialist, people get sent to me. So they've already made the decision that they want to lose weight or they want to better manage their weight. So that's a little bit easier for me. But on the other hand, I also am a primary care physician. So my thing is that whenever someone has any comorbidity that we can see related to overweight or obesity, and I'm counseling on lifestyle things because I don't like to do medicines at first. I might bring up like, hey, so there's a couple risk factors for why your blood pressure is high, let's say. I can mention you're sedentary, you're not exercising a lot, you're overeating salt, you're drinking alcohol, and also your weight suggests that it's not a healthy weight for you. Like I always like to root it into a health I don't want to say issue or like an illness that has a relation to overweight or obesity. But I personally will never just, if there's a person in my room and they happen to be overweight or obese, bring it up if there's no like readily discerned health factors. Because for me, my family, and including myself, have dealt with overweight and obesity, and I haven't had any health issues, thank God, related to it. But it used to be so frustrating to go to the doctor and they'd be like, oh, you're on the scale, when you're a child, you're in the 99th percentile for weight, you need to lose weight. And I'm like, okay, great. How? There was never any reasoning how or why, especially if there was no data to support that it was making me unhealthy. So for me, I have it kind of easy in that the vast majority of my patients come to me because they were sent for weight management. But if I'm dealing with my own patients, I like to root it in a health issue or wait for them to bring it up themselves. Because a lot of people now feel empowered to talk about wanting to lose weight because we have actual interventions that work and are healthy or healthier and safer than like what we had in like the 80s with fen that had people dying from cardiac arrest. Like we have true things that work and have other health benefits. So a lot of patients feel more comfortable and more empowered to want to bring up weight loss by themselves.
Mm. So one thing we haven't touched on is bariatric surgery. How common is that these days, and what is the criteria to determine if a patient is a good candidate for bariatric surgery?
So the criteria is shifting a little bit. So it can be a BMI of 35. It also depends on the person's ethnicity too. So a BMI of 35 or of 40 with, or excuse me, of 40 or 35 with comorbidities. So that I see a lot of people less and less actually going the bariatric surgery route because you can get a significant amount of weight loss with these medications. And I've also had a fair amount of people who have undergone bariatric surgery and regained the weight and now are on these medications. Like I have a ton of patients that fall into that category. So I think because no surgical procedures without risks, that a lot of people are trying to at least try to lose weight on their own with these injectables because you can lose a significant amount. And then if that fails, then go the bariatric surgery route because we do, again, have things that can actually work and work well.
So tell me a little bit about what you hope to see in the future and what you're excited about when it comes to treating and preventing obesity in patients.
A lot of things. So again, because obesity affects so many parts of your health, I'm hoping that with the advent of these medications that actually work well, we see a decrease in all of these things. So like a decrease in dementia, a decrease in cancer, a decrease in the incidence and prevalence of diabetes, high blood pressure, high cholesterol, also of other surgeries, not just bariatric surgery, but a lot of people undergo orthopedic surgeries because of undue pressure and degeneration of their hips, their knees. So less of that, which is also less taxing on our healthcare system because surgeries are expensive. And also just less stigma about overweight and obesity. Again, less of thinking that it's something wrong that the person is doing and acknowledging that it is a chronic illness. And hopefully that then trickling down into more and more pharmaceuticals being made to target this and effectively so. Also hoping for better insurance coverage of these things because we have so much data that they work well. They have other FDA approvals for like sleep apnea, for chronic kidney disease, for heart failure, for stroke, yet it's actually becoming harder for getting insurance coverage. It's like they're blind to the benefits of these medications. So I'm hoping for more insurance coverage, which will increase access and cost of these medications to get it to the populations that need it the most, so that we can see decreases in cancer, in surgical procedures, in dementia, in all of these things that I mentioned before.
Thank you so much for joining us, Dr. Duah. It's been a pleasure.